Are you experiencing low back pain? Have you been having low back pain in the last 30 days, in the last year? If so, you're not alone. This month we are going to explore some information on low back pain, some tips and tricks that maybe you haven't tried to give you some information about low back pain. So hopefully you find this valuable. My name is Biagio Mazza. I'm a physical therapist with Elite Physical Therapy, and I hope you enjoy the video. Today we're going to talk about some effective self-tests for your low back pain. How can you tell if it's your back that's causing some of your problems? Now that may seem silly. You may think, well, it hurts in my back, so it's coming from my back. That may be true, but going through some of these tests can give you kind of an idea and a frame around what's going on with your back even a little bit farther. So the first thing that we're going to review is how to do low back range of motion testing. So there's really 4 directions that we're going to go through. The first is going to be bending forward. So as you bend forward, and bending forward without, the knees don't have to be locked out, but without allowing the knees to bend like in a squat. So you're going to just bend forward as if you were going to touch your toes. And you're going to kind of look for 3 things. You're going to look for quality, for quantity, and for provocation. So quality is how clean it looks as you're bending forward. Quantity is how far down you could reach. And provocation means, does it create any symptoms? So when you bend forward, the thing that should stop you from continuing to bend forward is the back of the legs. If you feel that in your back as you bend forward, that is not cool and that is not okay. So if you are feeling it there, that's giving you some indication that, hey, something's going on that might need to get looked at. The next motion is backwards. So you put hands on your hips, you lean backwards as far as you can comfortably. The thing we're looking at here is the same thing, quality, quantity, and provocation. But here we would expect the back maybe to feel a little tight as you get to the end ranges, and that's just the way that the anatomy is set up. That would possibly create a little bit of tightness or discomfort in that direction that's semi-normal. Okay? And then the 3rd and 4th are side bending side to side. So you're going to lean off to one side, kind of bring your hand down your thigh on one side, same thing on the other. It should be symmetrical, and neither direction should cause pain into the low back. Okay? The next test we're going to talk about is a neck flexion or neck bending test with bending forward. So what you do is you bend forward, you get to your end range or where you start to feel any discomfort, then you bring your chin to your chest. Then you bring yourself back and bring yourself back up. If the chin to the chest actually increases your symptoms more, that is giving you some information about what could potentially be causing your low back pain. Usually, if that test is positive, we're potentially thinking something related to the nerves, possibly the disc tissue, because of the connection from the brain all the way down to the low back, that as you bring your head down, it pulls on that nerve tissue and it can reproduce back pain. So if that's positive, that can be a nice test to indicate some different things in your back are going on. And then the last test is called a slump test. What you do with a slump test, it's kind of like it sounds. You sit down and you slump down. So you kind of sit with a real crappy posture. Just put your hands kind of in your lap or kind of at your side. You let your head come down to the chest. In that position there, what you're going to do is point your toe up in the air and slowly kick out until you feel either a stretch or a reproduction of your pain. Now, if you feel a reproduction of your pain in your back, that is significant for telling us what is going on with the symptoms, because same thing as that little chin tuck test, as it pulls the nerves, that can pull on the disc or can pull on the nerve tissue, and if it reproduces your symptoms, that's a quality bit of information we would want to know. Then you would do the same thing on the other side. We're again looking for quality, quantity, and provocation. In this circumstance, we're looking more for the amount of motion that you have and if it provokes any of your symptoms. So those are 3 tests that you can go through to kind of self-test yourself. The normal with those should be all of those. Like when I just did all those right there, I didn't feel anything. So that's a normal test for range of motion, for that chin tuck test, and for that slump test there. And I hope that gives you a little bit more information and helps. I hope today's video was helpful. If you want to know more specifics about your own body, then please either call me or email me and ask the office to set up a free 30-minute consult with Biagio, and we can get you checked out.